Okay, so as Dan said, we're just going to introduce you to the discrete event simulation model that we produced for a mental health hub. Next slide, please, Nathan. So by way of introductions, I'm Helen Wharam. I have Nathan also working with me. We work for, and I need to get this right because we've just merged, Hampshire and Isle of Wight NHS, Healthcare NHS Foundation Trust. It's a community mental health. It's a large trust providing approximately 220 services. We provide community, mental health and learning disability services across Hampshire and the Isle of Wight. So I am Helen Wharam, as I've said. I am an occupational therapist by background, but for the last 10 years, I have worked in our Academy for Research and Improvement, having moved into research and then an improvement role. But for the last 3 years, I've been running our demand and capacity programme, and that's how I met Nathan. Nathan is a mathematician by background. He has formerly worked as a maths teacher, but for the last few years, he's worked for the Trust as a data manager, largely with our Portsmouth mental health services. And I think it's really important to say that Nathan and I have absolutely no experience in operational research, data science, or programming. So we came to this program as total newbies. Next slide, please, Nathan. And you're probably wondering why we joined the program. And I think it's because as I went through our demand and capacity work, I identified that there's a real skills and knowledge gap within our organisation, and this is around operational research. As I started to understand that, I became aware that actually this could really support demand and capacity management and planning for services with an evidence base, but also some of the large-scale transformation activities, and it could sit within the Academy for Research and Improvement. So Nathan and I joined forces, and we've used the HSMA programme to develop knowledge and skills, largely around operational research and discrete event simulation. But what we want to do is showcase the art of the possible through developing a model and use this as a springboard for developing roles within the Academy. Next slide, please, Nathan.
So when we were looking at what project to do when we came to the Inception project, we looked at sort of the main parts in the service that needed impact and change. So we had a look at lots of different services. We looked at a service before, and we were looking and scoping that service out, but we found that the data wasn't strong there, and that the pathway wasn't clear. So we looked at a new service that I knew a lot about, where I've been developing a lot, which was the Portsmouth Mental Health Hub, which is a service that was created about 2 years ago. It's a call centre service that signposts you to mental health services. It's about being able to give service users the right advice and go to the right place so they're not bouncing around the system, and so that they can get that support when they need it, for not just for themselves but for anyone that they wanted. So we based our model on this. We wanted to look at how the service is managing its capacity and how it manages demand. We've currently got lots of data on that, but we wanted to compare it and to be able to use that to predict when we look at expanding, and as demand grows in lots of different ways in terms of its routes and in terms of expanding as a service when its demand goes up. So we wanted to look at understanding its cues and the resource requirements that related to that. So here is I just lost the next button. Look at that one. Here it goes. So here is the sort of the model that we have for the hub. So you just understand what happens, what we were trying to simulate here with our DES model. So we have quite a few different call routes in, and we wanted to differentiate between these because they have quite different elements to them that will affect the simulation in terms of how often they have calls in the day, and how long it takes for a call handler to deal with them for the whole piece of work. So this service is open from 8 till 6. So we looked at it as one run as one day, and we want to look at each day. So we had those. Once they come through, we put them through to a queue. And the other part that we had about it was that it has two different types of call handler: a facilitator that acts slightly differently, they're the main call handler that's come through, and a practitioner who's a more specialised nurse in mental health. They would then respond to that call, and then that call would be completed. So we wanted to look at that first part, that queue length at the beginning, and then after that, how much we're utilising that resource within our model, all the way to completing call, and then it would go back through the system and take on the next call for a queue. So some of the model outputs that we wanted to look at were mainly looking at those queue outcomes at the beginning to look at some median wait times. So currently with our code, we focused on the wait times, the queue times, and our use of the facilitator. So you can see we've got two different distributions that show how much time is being used up for the practitioner and for the facilitator role. And so once we understood that, we can understand the usage. For our next steps, we want to now bring this on and bring it on further. Now we created the code underneath, and we wanted to move it into a Streamlit app. We've started off that process, and we want to add in a lot more outputs that will be understandable for our stakeholders. So we want to look at histograms. We want to bring in box plots to understand our distributions better. We want to have key performance indicators in terms of our average queuing, our numbers that are waiting at certain points, our maximum numbers, and just our utilised percentages for facilitators and practitioners, so we can make good judgments in the future in terms of how we could change that and what would happen if we change certain things. And that's why we have these changeable parameters that we want to put into the Streamlit app. So we want stakeholders to be able to change the number of facilitators and practitioners, change how often they're available. So it may be that the practitioner, we want to do some other pieces of work as well, so they won't be available all the time. Change the length of opening. What happens if we've made it that we had a longer opening time, especially if we found that that callers wanted specific times, there's more demand at specific areas, could we extend that? And then we also wanted an advanced function capability as well within it to look at the average call lengths per different call route, and also to look at the length and the frequency, but also to look at different call priorities. So you could change the priority that came through for each call route. We also want to bring along because this is the first time we've used this within our trust, we want to bring along some supporting resources so people can use it and we can develop it as well and get feedback from stakeholders on everything we've done. So that's kind of our major next stage, is to get that feedback as well from key stakeholders.
So we do have a number of anticipated impacts. So at the moment, the GP divert calls are only for one primary care network. The plan now is to roll that out across more PCNs. So this model is going to enable the hub to understand the impact of more calls coming in and look at the possible resource requirements and the cost implications of that expansion. That will also help to ensure cost effectiveness, so we can look at the ratio between facilitators and practitioners. And also exciting conversations at the moment as the trust has merged. The hub is only available in Portsmouth, and there's now interest being expressed in rolling this out across other geographical areas within the trust. So the model should help with evidence-based planning to inform more service developments. And for me, there's something about contributing to a wider culture of continuous improvement. If we can use this model to showcase the value of operational research skills within the academy, then that is brilliant, because that's another tool that helps us to support a wider development of that culture of really evidence-based informed improvement and transformation activities. Next slide, please, Nathan. And we just have a few words of advice here for people who are thinking of coming on the programme. Nathan and I came together, and we would really recommend that you come with someone else from your organisation. It has helped us so much, and we've both said we may not have landed where we have landed if we'd come individually. We've worked as a pair, but also we've had really different strengths. We work in different parts of the organisation. We have different roles. So we've been able to bring those skills together. And the other thing is about choosing a project and not being too ambitious. Really ensuring feasibility of what you're going to deliver. We didn't get it quite right first time. I had to change track. Access to data, I know other people have talked about it. Make sure you can access data. We've had fantastic support from our managers, and we've been able to ring fence time, and we are still ring fencing time. And without that, it would have been really, really hard for us to progress. And the last little bit, and I think this is really important, is just keep going at it. Be like a dog with the bone, because actually when the going gets tough, and I think everybody would say it can get tough on this course, just keep going, keep chipping away, and you will eventually reap the rewards. And thank you. That's the end of our presentation.
Thank you very much, Helen and Nathan. Fantastic presentation and fantastic reflections there as well. Really good words of advice. And yeah, fantastic to see how much you progress. I'm really excited to see how this project progresses. I think it has the potential to really engender some really interesting change there.